I think we are live now. So, yes. Hello, everyone. So, let us wait for another 2 to 5 minutes. Let the student join the session and then we'll start our today's discussion. Hello, Purvi. Very good evening. Very good evening, Purvi. Very good evening, Vijay. Very good evening. Let us just wait for 5 more minutes. Let more students join us and then we'll start today's session. Okay. Today also we'll be having multiple choice question round as well as the theoretical part, and we'll also learn about the nursing intervention of the topic. Soon I will reveal the topic which today we'll be discussing. I hope you all are doing great. I am absolutely fine. Thank you, Purvi. How are you guys doing? Very good evening, Tanveer. Tanveer have also joined us. Very good evening. Okay, so now we can start. So again, I welcome all the students, those who are here in the comment section. I welcome to all in the Nursing Next Life platform under plan UG NORCET, your digital coaching Pathshala. So this plan is all about how we can, strategically prepare for our upcoming futuristic goal along with your undergraduate preparation, right? But and again, today we'll be having nursing foundation class and I am your mastermind faculty and session mentor. But before we will directly go and start discussing about the topic, I really want to share this very beautiful quote with you all. These are the four important, you can say four important mantra, in a way you can say, to become a very successful person and a very good human being in your life. So what are those four key important success mantra, you can say? Number one, believe in yourself. Always remember, this is a very important point, that first, in order to let other believe in yourself, first you have to believe in yourself, that yes, whatever I am doing, I am doing for myself and I'm doing great. Yes, so first point is you have to believe, you should have this belief that I am doing great, and keep on praising yourself. This part, this is also very important. At the end of the day, if you have used even 1 hour productivity, then also praise yourself, give yourself rewards. That will basically encourage you, keep you going. So first important point is you have to believe yourself. Second, trust yourself. Third, love yourself and invest in yourself, because this is the time when you can sharpen your future. You are at the time when you have everything in your hand. You have time, you have resources, everything is there. All you have to do is you have to use all the resources, use your time very wisely, so that you can sharpen your future in a very productive way, in a very successful way, right? So remember these four success mantra, and I just want that all the student who want to secure their future, who want to become successful, everyone wants to become successful in their life. So just focus on these four rules, which is believe in yourself, trust yourself, love yourself, and invest in yourself, right? So today we'll be discussing about the assisting patient, how we can assist the patient in ambulation, and we'll be also learning about the care of patient with CAST, right? So these are some of the specific outline and the specific objectives. So at the end of the session, you'll be able to know how to provide care with the patient of CAST and what are the stages of ambulation. Right, if I talk about for a term examination, the importance of this subject, you can expect one question from the nursing responsibility side. Generally the question comes like nursing, you have to write down short note on nursing responsibility or nursing care plan on a patient with who is having fracture of femur, and on cast, plaster cast has applied, right? So nursing intervention part is very important. If you are a first year nursing student, if you are, or second year nursing student, if you are third and fourth year nursing student, and who are someone who is preparing for their upcoming, future nursing entrance examination for any government hospital, then also this topic is important, because many time question asked in multiple choice question form related to cast application. For example, like the question can there are a lot of question in your competitive textbook related to complication of cast, and as a nurse, if any complication arises, what will be your priority intervention, right? So all in all, we should be aware about the nursing part or nursing intervention, how we can provide the care to a patient with cast, right? So let us first start with how we can assist the patient with ambulation. In my previous lecture, I have also we have discussed this part, that ambulation is very important, right? Immobility, the immobility result, or it can lead to number of complication. Immobility can cause pressure ulcer, ischemia, and there are various effect that can occur on a patient body. This is the reason why, especially I have quoted the example of post operative patient. So in post operative patient, like I said previously also, doctor, they prefer that we ambulate the patient as soon as possible, so that we can minimize the further risk of complication, right? So today we'll be discussing about, if we have to ambulate the patient, then what are the common exercises, and what is the process of ambulation, or in a way we can say the stages of ambulation, right? So what does ambulation means? First we need to understand this. What is ambulation? Ambulation hota kya hai? So ambulation is simply we are or patient is moving from one place to another. In simple layman language, ambulation is patient is moving from one place to another is called ambulation. Patient एक जगह से, जैसे you must have seen many time in hospital, or maybe you have done this by yourself also as a student, or maybe when you were working as an intern, you have assisted the patient in walking. That is ambulation. You are ambulating, you are helping the patient in ambulation, right? So if your patient is, as per the doctor order, your patient is advised for ambulation, then there are certain set of exercises we want the patient to perform, so that patient, the muscles required for ambulation will be will be strong enough, so that patient can start walking, patient can start moving, right? So ambulation, let's take again the example of post operative patient. After your patient is admitted into the post operative unit, and this is your day one, and as per the medical condition, the doctor said we have to start ambulation period. So before we should actually instruct the patient that please get up and start walking, no, this is not the procedure. What will be the procedure? We have to first focus on the muscle strengthening exercises that we have already discussed in our previous lecture. Along with that, we have to focus on some few basic way or basic exercises which directly involved in the process of ambulation. And what are those exercises? These are quadricep or gluteal setting drill, dangling and push-up. Now let us see one by one. First is quadricep. Now we all know that quadricep muscle plays a very important role. This is your quadricep muscle, right? हमें पता है that quadricep muscles is a major muscle when which we require as a in a physiology of, in a function of moving, walking, running. So quadricep is your major muscle. of the thigh, of the top of your thigh. Under quadricep, again under quadricep, this particular muscle, which is vastus medialis obliquus, this muscle, in a short form we can say VMO, this muscles is again major muscles which play a major role in walking of the patient, walking or running or maybe moving of a patient, right? So we have to make sure that this particular muscle should be, should have minimum strength that the patient can start moving. How we can do so? We have to work on this particular muscle. So how, but what is the basic exercises that we can instruct the patient to strengthen this quadricep muscles is quadricep setting drill or quadricep exercises. Now listen this very carefully. What we have to do in this quadricep muscles exercises, in this particular exercises, this exercises can be performed either in supine position or sitting position. Here in image B, you can see this is your supine position. That means patient is lying on their back. That is supine position. Here in this image B, you can see patient is sitting, is in sitting position, right? So patient can be either in supine position or in sitting position. Now what we have to do in this exercise, we have to first, let's take an example that we are performing this exercise in sitting position. So we have to make the patient sit like this, and either with both the leg on the bed, right? And we have to ask the patient, what we have to do, we have to ask the patient to put pressure on the knee, on the knee part. What we are doing, we have asked the patient to put pressure on the knee part. While doing this, while applying the pressure on the knee, what other instruction we have to give to the patient? Dorsiflex the foot. This is dorsiflexion. We have discussed this in our previous lecture, right? What two important instruction we have given to our patient? Number one, apply pressure on the knee part, on the knee of the patient. That means we have to ask the patient to put pressure or press the knee towards the bed. In this way, he is applying the pressure on the knee. While doing this, we have to again ask the patient to dorsiflex the foot, the same foot on which he is applying the pressure. When the patient will perform this dorsal flexion of the foot, what happen? It should basically make the heel of that foot lifted, slightly lifted off the bed, right from the bed. Clear? So this is your quadricep exercises. What exactly is happening here? We have asked the patient, we are not asking anything to rotate the hand, to rotate the leg. No, there is only contraction. It is the contraction exercises. The what is happening in quadricep exercises? Contraction is happening. How contraction can occur? Simply by applying pressure on the knee part, and for comfortable, to make it more comfortable, you can also apply a towel roll under the knee, right? So ask the patient to press the knee and dorsiflex the leg, dorsiflex this foot. By doing so, the patient will feel contraction, and you can ask the patient to place one another hand underneath the knee so that patient can feel the contraction by himself or herself. This is what quadricep exercise means. In this way, we are creating contraction of the quadricep muscles. Now, one question from my side to all the students who are in comment section, you have to tell me which type of muscle strengthening exercise we are performing in quadricep exercise. In quadricep, if we are performing this exercise, so which type of muscle strengthening exercise is this? Is it isometric exercise? Is this isotonic exercise? Is this isokinetic type of muscle strengthening exercise? Now tell me the type of muscle strengthening exercises that we are performing to strengthen the quadricep muscles. Yes, anyone from the comment section? We have already discussed this part, the muscle strengthening exercises. There are three types of muscle strengthening exercises: isometric, isotonic, under isotonic, concentric and eccentric, and isokinetic. Here I have explained about quadricep exercise. How to strengthen the quadricep muscle. So which type of muscle strengthening exercises here we are explaining? Now tell me which type it is. isometric, isotonic, isokinetic. Think. What? Very good, Shubham. Shubham has given a very beautiful and very correct answer. Excellent, Shubham. Very good. So this is your isometric exercise. The reason behind, because we are not asking the patient to rotate the leg, to flex the leg, or there is no joint movement. As simple as that. So if there is no joint movement, there is only contraction. That means the length of the muscles from the origin, remember, from the origin till the insertion part will remains the same. There is no change in the length of the muscles, right? Which makes it an isometric exercise. Very good, Shubham. Right? So this is your quadricep exercise. Gluteal setting drill. What is exactly gluteal setting drill? In this, again, we'll make the patient in a supine position and we'll ask the patient to squeeze the buttocks in and squeeze the buttock in and remain in place for remain in place at least for 5 seconds, right? And then release it. So we have to ask the patient, squeeze the buttocks in and then count it for 5 and then release it, relax it, right? This has to be repeated in sets, maybe 10 times a day. A patient can repeat the same exercises. So this is, yes, one of the exercise that we can instruct the patient, provide education about the patient before ambulation in order to strengthen the quadricep muscles. Now, other than that, we have push-up as well to strengthen the muscles of the arm, right? Upper arm and forearm. We can ask the patient to perform the push-ups on the bed itself. But again, it should be performed under strict guidance and surveillance. The nursing staff should be there, and as per the doctor order only, we have to let the patient perform these exercises. Now, let's talk about the stages of ambulation. So this is all about the way through which we can, encourage ambulation by performing some sort of exercises. Now, what are Shubham, range of motion? We have already discussed in our previous class. If you haven't watched the the video lecture is available in this channel only. You can watch the lecture there, right? Now, stages of ambulation. If I talk about the stages of ambulation, so ideally there are 3 stages of ambulation. Now, you have to listen this very carefully because we will be discussing important MCQ part as well. Now, what are the 3 stages of ambulation? How many stages are there? 3 stages are there. अगर आपको किसी भी पेशेंट को एम्बुलेट करना है आफ्टर एनी प्रोसीजर, सो देर आर 3 स्टेजेस. नंबर 1 स्टेज जो होती है वो होती है डैंगलिंग. सेकेंड स्टेज इज मेक द पेशेंट स्टैंड and the third stage is ambulate. Finally, the final stage is we have to ambulate the patient from one place slowly to another place, right? So these are the 3 stages of ambulation. Now my question is, stage number 1 is very important. Dangling is very important. What does this mean, dangling? What does this term mean? Right, now let us see dangling hota kya hai, what exactly dangling means. Now here you can see a picture. We are having a patient. So let's take an example that this is your patient and this is the bed. So what exactly dangling mean is, you must have seen that if, let's take an example that if you are in, I'll give you my example. I was posted in a surgery ward and I was asked, one of the sister asked me that you have to assist the patient in ambulation. Right, so I went to the patient bedside. I again I informed the patient about myself, that I am a intern and I'm working, my shift duty is this timing, and I asked the patient that I have to assist you in ambulation. Can you please get up from bed? Right, this is what I instruct the patient. So because patient is conscious, patient can able to do so. Patient all of a sudden from lying down position, my patient was in supine position. Now I hope you all are aware about supine position is patient is lying on his or her back, leta hua hai pura, that is supine position. So patient was lying in a supine position, and when I asked him that we have to walk and I have to assist him, the patient immediately from the lying position, patient immediately assume the patient immediately stand. Right, now when the patient stand out of the bed, when the patient stand, Within, within one minute, the patient felt dizziness, and patient was like, patient felt dizziness, and patient was lying on the floor. Now here you need to tell me what was the mistake I did while, while this entire scenario. What was that mistake I did here? Anyone from the comment section, what mistake I did? I asked the patient that we have to ambulate, and I will be assisting you in the ambulation process. And the patient was in lying down position. And the moment I said this to patient get up from the bed in standing. Patient was standing out of on the floor, and within 1 minute, patient is fainted and lying on the floor. What has happened here? Anyone from the comment section, what has happened here in this scenario? You just think about this scenario. What went wrong here? Anyone from the comment section? ऐसा क्या हुआ which makes the patient lying on the floor and patient felt dizziness? ऐसा क्या हुआ? Any guesses? Anyone from the comment section? Patient was in lying position. I said we have to ambulate. Immediately patient get up, and patient was standing on the floor. Within 1 minute of standing, patient felt dizziness, and patient said मुझे चक्कर आ रहा है, and patient, the moment after this, patient felt on the floor. नीचे फ्लोर पे पेशेंट गिर गया. What has happened here in this scenario? Anyone from the comment section? This is something which as a nurse we should know. Very good. Shubham has given again very beautiful answer. Very good, Shubham. So this is Janvi ने भी यहाँ पे very good. Janvi very beautifully said and very correct. Dangling was not performed here. Patient directly stood up, right? And this is why patient was experiencing orthostatic hypotension. This is very important. We should as a nurse know about, because as a day-to-day activity we are more involved with the patient, with their care, with their ambulation process. So we should be aware about as a student as well, because at one point we will be working as a nursing staff. So this is the reason why, the reason behind this, that why the patient fainted and felt dizziness and lying on the floor, because patient was experiencing orthostatic hypotension. And why patient was experiencing orthostatic hypotension? Because we have not performed the dangling. Janvi is absolutely correct. You have not performed the dangling first stage of ambulation. You have straight away patient from the bed, from the lying position, patient stand up, right? So this will cause change in the systolic and diastolic blood pressure. Now here we need to take a brief description of orthostatic hypotension. Again, like I said, that you all must be having a separate book or register for your any competitive entrance examination preparation. So there you have to write down the definition of orthostatic hypotension. Anyone from the comment section can tell me how we can define orthostatic hypotension? Question number 1. And second is, what is the other name of orthostatic hypotension? What is the other name of orthostatic hypotension, and how we can define orthostatic hypotension? Now let us see. This is a very important part. Many times you can this has been asked in competitive entrance examination, and you can see many questions on orthostatic hypotension in any competitive entrance examination book. So what is orthostatic hypotension? The other name is, this is also known as postural hypotension. Point number 1. Orthostatic hypotension is also known as postural hypotension. Now how do we define orthostatic hypotension? कैसे बोलेंगे? In which condition we can say that patient is experiencing orthostatic hypotension? If the systolic blood pressure is less than 20 millimeter of mercury. If the systolic blood pressure is less than 20 millimeter of mercury and diastolic blood pressure is less than 10 millimeter of mercury, right? Then the normal जो patient का baseline data था, if there is change is very good, Shubham. Systolic, but systolic 10 नहीं होगा. In systolic blood pressure, there will be 20 millimeter of mercury. Difference or decrease in, you can say decrease in systolic blood pressure of about 20 millimeter of mercury. And diastolic millimeter में कितना होगा? Decrease 10 millimeter of mercury, right? Within 3 minutes of standing. Within 3 minutes of standing, that means it is your orthostatic or postural hypotension. Systolic blood pressure, there is decrease in 20 millimeter of mercury. Diastolic blood pressure, there is decrease in 10 millimeter of mercury. This you have to write down. Shubham, please correct yourself and write down this. Everyone in the comment section, write down this in your last minute revision notebook, because this will be very important, and it is this will help you in your last minute revision part. Systolic blood pressure, decrease in systolic blood pressure 20 millimeter of mercury. Diastolic blood pressure कितना decrease होगा? 10 millimeter of mercury within 3 minutes of standing. That is called as postural hypertension or orthostatic hypertension. Right? So in order to avoid such type of complication, the process or the stages of ambulation should be performed in a very in a very careful manner. So number one, before we should ambulate the patient, or before we should make the patient to from a bed एकदम से in a standing position, we have to perform dangling. What is dangling? Dangling किसे बोलते हैं? Dangling is nothing but we are asking the patient to first, from the lying down position, first to sit on the bed, assume a sitting position, and then अपने दोनों पैरों को इस तरीके से जो है बेड के साइड पे लेके आना है. First, from the lying down position, make the patient sit down on the bed, and then ask the patient to come, basically to come closer to the bed का जो side होगा, edge होगा, वहां पे आने के लिए बोलना है. दोनों पैर को patient के इस तरीके से बोलना है, that you have to place both the hand like this, right? And one more thing, in the process of ambulation, in this dangling stage, we have to make sure the bed is completely locked. Your bed should be locked, patient का जो bed है. And second, the position of the bed should be low. बहुत ज़्यादा high नहीं होनी चाहिए. When the patient perform this dangling, when the patient both the feet, right, are basically are on the patient के bed के edge पे, so it should touch, or it should be just above the surface of the floor, right? It should not be far from the floor. So position of the bed should be low, bed should be completely locked, and ask the patient to sit on the edge of the bed before standing. Clear? पहले lying down से we have to make the patient sit, and then may ask the patient to sit on the edge of the bed. Bed should be locked and on the lower height side पे होना चाहिए. And then we have to ask the patient slowly and gradually you have to stand. While the patient is standing, you can support the patient. Always use safety belt. We have discussed about the gate belt, right? When we were discussing how to transfer the patient from the bed to the wheelchair, that time we have said that we can use the gate belt to lift the patient, right? Because यहाँ पे हम patient के linen को नहीं use कर सकते to lift it. So you can use the gate belt again. So you can again provide the gate belt, and with the help of gate belt, you can support the patient and help the patient to make the to stand. Clear? So dangling is very important. Don't forget to perform the dangling, which is the first stage of ambulation. Clear? Straight away, this is the best way to prevent orthostatic hypotension. Once the patient is stable, उसे लग रहा है कि yes, I can stand now, then slowly and gradually help the patient and make the patient stand. Once the patient assume the standing position, again wait for 1 minute, 1 to 3 minutes. It's not like within the moment patient stands, start ambulating. No, everything should be done in a very careful manner and slowly. So once the patient assume the patient is in the standing position, then slowly and gradually start ambulating the patient. Clear? So these are the three stages of ambulation which I really want all of you to know, especially in this the complication of orthostatic hypotension, which is very important for your exam perspective. And if you are a first year or second year nursing student, orthostatic hypotension always comes in your 2-mark question related to the definition that define orthostatic hypotension. So you should be aware about how we can define this medical terminology. Right, so this is about your ambulation part. Now let us see how we can care patient with immobility. Although some of the aspect we have already discussed in our previous session, let us see more about the patient with immobility. Now just remember one thing, whenever we are talking about immobility, yes, immobility, that means patient is unable to move. If the patient is unable to unable to move, then what all complication can arises? If the patient is unable to move, then what will happen? What will happen to perfusion or blood flow? What will happen to blood flow? It will become stasis. There will be decrease in the blood flow. When the blood flow get decreased, let's understand with this image. Let's say that this is a vessel, right? This is a vessel and we are having blood flowing in this vessels. So this is your blood which is flowing in these vessels. For some sort of reason, it could be immobility causing injury to the endothelial lining, or because of presence of inflammation of edema, the blood supply to this area, the vessels get constricted, right? The vessels get constricted. So what will happen? If the vessels get constricted, now the blood flow, what will happen to the blood flow? Blood flow will get decreased. The blood flow, because now we are having less space. The blood is having less place to pass through and reaches to the cell, to reach to the cell. This is your cell, right? If the blood flow is decreased, blood flow stasis happen, then what will happen? There will be more, one more point, the not enough amount of blood will reach to the cell, right? If the blood flow will get decreased, then what will happen? So there will be less oxygenated blood received to tissue. Yes, very good, Shubham. Very said. This is one of the complication of immobility, pressure ulcer, right? Less amount of oxygenated blood will be received to the cell and tissue. That means less metabolic process will get slowed down. Metabolic process will get slowed down. Right? Metabolic process will get slower down. What will happen further? It can result into ischemia because they are not receiving enough amount of oxygenated blood, right? And further with the ischemia, what can happen? It can result into muscle atrophy and it can further result into necrosis, which is on the later stage. Clear? Now one more thing which can happen with the immobility, likewise, like we said that here so far हमने ये डिस्कस किया that blood flow to the cell or tissue will get slower, right? हमारा क्या हो रहा है? जो blood flow है, it is going very slowly. It is basically passing through the vessel very slowly. क्यों ऐसा हुआ? क्योंकि pressure पड़ा vessels की wall पे and it will get constricted. Now what will happen further if the blood flow gets slow? So हमेशा याद रखिए कि जब भी blood flow slow होता है, इसके साथ क्या होता है? The viscosity. Now what do we mean by viscosity of blood? What do we mean by blood viscosity? Means thickness of the blood. Blood कितना गाढ़ा है? That is viscosity. Viscosity means गाढ़ापन, thickness. So the blood viscosity क्या होगी? बढ़ेगी या कम होगी? What will happen to blood viscosity? Whether it will increase or decrease? If you are having, यहाँ पे देखो, listen to this part. You are having this space. So here the blood can easily travel, easily run, easily flow, right? The blood viscosity will not be decrease or increase, but the same path or the same vessels through which the blood normally flow will get constricted. Now blood is having blood is getting less space to flow. So what will happen? Blood flow will get decreased. If the blood flow will get decreased, that means the viscosity will be increased. So there will be increased viscosity. ब्लड का जो गाढ़ापन होगा, द थिकनेस ऑफ द ब्लड विल गेट इंक्रीज, बढ़ जाएगी, राइट. विस्कोसिटी अगर बढ़ जाएगी, देन व्हाट विल हैपन इफ द गाढ़ापन, जो थिकनेस है ब्लड का, वो बढ़ जाएगा. व्हाट विल हैपन इफ देयर इज इंक्रीज विस्कोसिटी ऑफ ब्लड? that will result into clot formation. There are more chances कि clot ज्यादा form होंगे. भाई blood आपका गाढ़ा हो गया patient का, so it is more, there are more chances for clot formation. अगर clot formation होगा, then what will happen? Patient will be at risk of deep vein thrombosis, and deep vein thrombosis is what further complication get arises. The further complication arises is emboli बन सकता है. What is the difference between thrombus and emboli? Anyone from the comment section, what is the difference between a thrombus and emboli? What is the difference between thrombus और एक emboli में क्या difference है? देखो, thrombus clot है, दोनों ही clot है, but thrombus will remain in a place. Emboli क्या होता है? वही clot will get broke down and will flow in the blood supply, और वो blood circulation में flow करके it will basically will go in other circulatory area and can cause blockage, right, or obstruction. जैसे let's take an example. We have this vasoconstriction happening here in this vessels, and we have this blood clot formation, right? So this blood clot, because the blood is coming from this side, with the pressure, what happened? This clot get break down into pieces, and now this is called emboli, which can travel along with the circulation further into the other part of the body and can cause obstruction. And the most, the DVT, in deep vein thrombosis, the emboli, the most common complication where the emboli can cause obstruction is pulmonary embolism. This emboli, ये जो piece of clot था, break down होके it move with the circulation and can go into the pulmonary circulation. In pulmonary circulation, and there it can cause, what it can cause? It can cause pulmonary embolism. Now see what all complication can arises just because of the immobility. So this makes the a nurse to think that we have to, if a patient is unconscious, patient is bedridden, confined to bed, that makes us more careful while providing care to the patient, right? So immobility is very important to look after, otherwise patient are more prone for development of various complications. Pulmonary embolism is one of the final complications that can occur in a patient with immobility. Now there are many other complications. For example, like in case of immobility, patient skin, the skin of the patient is impaired. If you will not provide skin care, then what will happen to the skin of the patient? Skin will become impaired. That means there will be breakdown in the skin integrity, and if there is any breakdown in the skin of the patient, especially over the bony prominence area, then what will happen? Directly it can result into pressure ulcer. It can result into the development of pressure ulcer. Correct, right? So these are certain complications that can arise, so which makes us that we have to look after the patient with immobility. So you have to assess the degree of immobility, movement of patient. This is the reason why you must have seen that it is one of the very major intervention, especially in those patients who are immobile or confined to bed. What is the common intervention that we usually as a nurse we perform on a patient is, yes, these are, we have to change the position of the patient every 2 hourly. What are these common intervention? We have to change the position of patient every 2 hourly, right? Yes. So you have to change the position of patient every 2 hourly, point number one. Then you have to assess the skin of the patient, especially on the bony prominence area. And why we are changing the position every 2 hourly? So that we can make sure not on a particular point of a body over the bony prominence all the pressure is applied, right? The pressure get distributed, and all the part, the circulation is also circulation will not get impaired or diminished to a particular part, right? So we'll make sure the circulation is good. Will make sure that there is no pressure on a particular bony part. For this reason, every 2 hourly change the position. Second, passive range of motion exercises are very important to this patient. Passive range of motion exercises where you are performing the exercises on the patient can't able to do so, right? And again, we have to look for any sort of complication. The early we can identify the complication, the early can patient receive the treatment for the same. Yes. Now, what all other we have to the other support we can, other care we can provide to the patient? Comfortable position, like I said, every 2 hourly. Monitor circulation. Any any type of numbness, any type of tingling sensation experienced by the patient, or any kind of bluish discoloration. What do we mean by bluish discoloration? What is the medical terminology used to represent bluish discoloration of the skin? Anyone from the comment section can tell me the medical terminology that we use to denote bluish discoloration of any part of a body? What do we call it? Is, yes, this is cyanosis, right? Then use of trapeze. We have in the previous session we have seen the image of trapeze bar. Yes, this is also very important, especially for the patient who are confined to bed, or who are having lower leg plaster cast applied on their body. So they, with the help of trapeze bar, they can adjust or they can move. Very good, Miru. It is cyanosis, right? The diet is very important. Diet along with the skincare. Now, why diet is important? Why we have to provide a well balanced, high protein, high calorie diet to a patient who is unconscious or bedridden? Because we know that we, especially for those patients, in order to avoid muscle atrophy, which is one of the complication of immobility, muscle of atrophy. How we can prevent them? We can by providing high protein diet. Your body has a tendency to regenerate the cell. This we all know, right? Our bodies keep on regenerating the cell, but they require nutritional elements like protein, which is a building block, right? So how we can provide the nutrient to the cell and tissue? By providing the balanced diet. Clear? And again, skincare is also very important. Otherwise we will end up for the complication of pressure ulcer. So make sure all the prominent area are those who are having bony prominence, right? So especially all the part who are having bony prominent area, that particular part should be properly padded, and we have to change the position as well. You can use the ring air cushion, we can use water mattress, air mattress to prevent the pressure ulcer. That we have also discussed. In order to prevent pressure ulcer, water and air mattress are good to use. Elimination pattern is also very important, because especially the patient cannot move, cannot go to the washroom and pass the urine or defecate. So in such patient, Foley's catheter is used, right? And if you are using the diaper on a patient, then on on a very frequent basis, we have to check the elimination part, so that nothing can get the patient. We are the main reason is we don't want the patient to get exposed to the moisture, because moisture is one of the parameter that can lead to the skin breakdown and ultimately pressure ulcer. So make sure that patient skin should be healthy, dry, and it should not be exposed to moisture for very prolonged period of time, right? Then encourage deep breathing exercises to the patient in order to make the circulation, for improving the circulation. Right, so these are some of the measures that we can apply to a patient who is immobile or admitted due to some particular reason. A patient is confined to bed. Right, so this is all about care of patient with immobility. Now let us discuss our new topic, which is Cast, care of patient with plaster cast. So first we should know how we can define cast. I'm sure during your internship or during your first or second year, you must have aware about cast. You know plaster. What is the formula of plaster cast? This is a very important question from the chemistry subject we have all read during our schooling time, which is calcium sulfate, CaSO4. This is one of the formula which which is present for plaster cast. So how do we define this plaster cast? Plaster cast is basically, it is a solid dressing. It is a form of dressing that is applied to immobilize a particular part of a body. You can define it in this way also, that this is a dressing, or you can say it is a solid dressing which is applied to immobilize any part of a body. Clear? To any particular, to the limb or to any part of a body. Now let us see about this plaster cast, how many types are there and what are the material that we can use in present time for cast application, and what are the nursing responsibility. So first is, let us discuss about the type of cast. So there are various type of cast, you must have seen. Let us quickly revise it. So here you have two images, image number A, image number B. So this here image number A is short arm cast. Image number B is long arm cast. Short arm cast, here you can see this dressing is applied below the elbow. This is patient elbow, so this is applied below the elbow, and it is extended from this part till the proximal palmar crease. Proximal area is nearer and distal is the farther area, right? So from below the elbow we have applied this cast till the proximal palmar crease. Now why we have, in which condition we can use this short arm cast? If the patient is having wrist fracture or forearm fracture. In case of forearm fracture or wrist fracture, we can apply this type of short arm cast. If I talk about long arm cast, so long arm cast, you can see it is above, it is started from above the elbow. So cast is applied above the elbow till the proximal palmar crease is involved, right? So here we can use if the patient is having upper arm fracture or elbow fracture, or if it is elbow and forearm fracture. In this condition we can use this cast. Clear? Now let us see some more types. So we have for legs, we have short leg cast, leg cylinder cast, long leg cast. Short leg cast, here you can see it is below the knee, below knee till your this foot area, right? So below knee till foot area, here we can see, because it could be because of lower leg fracture or ankle fracture, there we can use short leg cast. Leg cylinder cast is above the knee area, the thigh area is covered, along with the knee and foot area is covered. So this can be used if there is knee dislocation, fracture of the knee and to the lower leg. Long leg cast is involved if you are having upper thigh fracture and knee dislocation, or in case of your lower leg fracture, right? So this is your long leg cast. In long cylinder cast, we have not extended the cast till the foot area. We have the cast is extended till ankle area only. If you can see, this is the difference between long cylinder cast and long leg cast. In long leg cast, we have extended till foot area. Clear? Now let us see some more type. This is shoulder spica cast. Shoulder spica cast, if the patient is having shoulder dislocation, then in that case shoulder spica cast can be used. So we have hip cast, hip spica cast. These are unilateral hip spica, 1 and 1/2 hip spica cast, bilateral long leg hip spica cast. Hip spica cast are generally used if the patient is having fracture of long bone, which is fracture of femur or hip dislocation, or in case of pelvic fracture. So in such condition we can use this type of cast. As a nurse, we should be aware about the name of the cast, where we can use, and the image based question can come. So you should be aware about, okay, this is 1 and 1/2 hip spica cast, right? Now, what is the purpose of cast? One of the basic purpose we have already discussed in the definition, that cast, the plaster cast, are applied to immobilize, to support, and to protect any particular limb or part of a body after a fracture, right? So to immobilize the body part, casts are very important to let the injured part heal and to regenerate and to stabilize itself and to undergone the process of healing. Casts are applied. This is, and for early mobilization, the application of cast is done, right? Now let us see the material that used in cast formation. So far, if I'll talk about traditionally, so pehle kya hota tha, that the only cast application that we know so far is we have a white color plaster cast applied on any fractured limb. It was white in color and it was very heavy. This is what we know so far. But nowadays, because there are so advancement in the medical science, we have one more material that we used in present day. This is fiberglass cast. Now let us see why one by one. So here this image number B is plaster cast, image number A is fiber cast, right? What is the difference between this plaster cast and fiber cast? We should know the difference, right? So yes, the difference between plaster cast, here on image number B on my right side, this is a traditional cast that so far we are using in the medical setting. This is very hard. Number one, you can write it down, these points. This such type of cast is very hard. Second point is they require a lot of time to get dry. Point number two, they require a lot of time to get dry, क्योंकि एक बार once the cast is applied, it should be settled down properly and it should be dry completely. And to let this cast, this white plaster cast, to get dry, they require a lot of time, right? Usually how much time they require to get dry? Usually 24 to 72 hours they require. Number one, this is very heavy, and this requires 24 to 72 hours, right? So this is heavy and it requires 24 to 72 hours time to get dry. Clear? So these are the 2 points that we need to remember in case of yes, exothermic and endothermic reaction, Shubham. Yes, these are important, and that topic I will be taking in the next section. In the next session, I will be taking the difference between endothermic reaction, what are the endothermic or exothermic reaction. That part will be dealt when we will start with hot and cold application. So don't worry, we will discuss this part of exothermic and endothermic as well. Clear? So now back to the topic. This plaster cast is heavy, very heavy, and require 24 to 40 hours to dry. On the other hand, this fiber cast, ये जो fiber cast है, this is very lightweight. ये क्या है? बहुत lightweight है. And the interesting part is it require very less time to get dry. Lightweight, point number one. It require only 30 minutes to get dry. It require only 30 minutes to dry. Another difference is generally ये जो plaster cast होते हैं are white in color, and this fiber cast are available in multiple color, like you must have seen purple, pink, blue. So it give a very pleasing effect to the patient. Clear? So this is light. Shubham, ये वाला जो cast है fiber cast, it require 15 to 30 minutes. So we usually take maximum time कि कम से कम उसे 15 मिनट लगेगा, but within 30 minutes it will get dry, right? Within 30 minutes this fiber cast will get dry, and this plaster cast will take 24 to 72 hours to dry. Clear? So this is the material that we are using at present time for plaster cast application, and moreover in the current setting fiber cast application is preferred more over plaster cast. रीजन हमने डिस्कस कर लिया, डिफरेंस. क्लियर? Now, one more very important point. If you have not seen till now, and if you're working, if you are a student or if you're working in a clinical setting, then this is something which I really want you all to experience or observe. Go to the जहाँ पे caste application होता है, orthopedic ward, or maybe any department where this caste application जहाँ पे किया जाता है, observe the proper process कि how the caste is applied. It is to be done by the doctor. Application of caste is to be done by the doctor, but as a nurse we should be know that what is the process of caste application. Let me give you a very brief picture of how or the steps of caste application. So what exactly happen is, हमें caste को apply करने से पहले we have to apply layers of bandages, some layers of padding should be done. वेरी गुड शुभम. कंपार्टमेंट सिंड्रोम हम आगे पढ़ेंगे एज अ कॉम्प्लिकेशन, राइट. सो बिफोर दिस डायरेक्टली हम ये कास्ट पेशेंट के हैंड पे अप्लाई नहीं करेंगे. दिस इज पॉइंट नंबर वन विच एज अ नर्स वी शुड रिमेंबर. वी शुड नॉट अप्लाई दिस कास्ट और दिस फाइबर कास्ट डायरेक्टली ऑन द अफेक्टेड part or affected limb of the patient. No, there should be multiple layers of bandages to be applied, and then we can apply this cast. So how many layers do we have to apply on the affected part? पहले हमें कितनी layer apply करनी है? Minimum total जो है 3 layer होती है जब हम patient को cast apply करते हैं. Total there are 3 layer of dressing. How many layer of dressing? 3 layer of dressing. Now what are those 3 layers of dressing? What are those? Let us discuss one by one. देखो, the first layer is soft roll dressing. सबसे पहले क्या आता है? There is soft roll dressing. Now what is this soft roll? You must have seen in ortho ward a lot of time, or maybe in ortho OT. There is a soft padded dressing which will basically act as a cushion or as a pad to the skin, so that we can prevent any form of infection, any form of irritation to the skin. Number one layer will be, the first layer will be soft roll layer, राइट. एंड हमेशा ये याद रखना है, ये ऑब्जर्व करना कि जो सॉफ्ट रोल होता है वो आपका जो ये वाला पार्ट है, दिस एज ऑफ दिस प्लास्टर कास्ट, जब आप अप्लाई करते हो उससे ऊपर तक रहता है, राइट. प्लास्टर कास्ट के ऊपर ये नीचे वाली जो लेयर है वो थोड़ा यहां तक खत्म होगी आपकी सॉफ्ट रोल की. इट वाज अ वेरी सॉफ्ट ड्रेसिंग, राइट. तो फर्स्ट विल बी सॉफ्ट रोल ड्रेसिंग. सेकेंड ड्रेसिंग आपकी जो नॉर्मल रोलर बैंडेज होती है, कॉटन बैंडेज होती है, वो अप्लाई करते हैं डिपेंडिंग अपॉन टू द लिम्ब साइज, 6 इंच की, 4 इंच की. सो फर्स्ट सॉफ्ट रोल, सेकेंड आपकी कॉटन की जो रोलर बैंडेज आती है वो अप्लाई करना है. उसे अप्लाई करने के बाद नाउ वी हैव टू अप्लाई द कास्ट. टू अप्लाई द कास्ट व्हाट बेसिकली वी रिक्वायर अ लार्ज बेसिन with lukewarm water. आपको क्या चाहिए होता है? Now this is your assignment. If you are in the hospital, you are doing your internship, you are working in a hospital, then I would suggest kindly go and watch this procedure, watch the steps of how the doctor is applying the cast. You will get more information, right? You will get your clarity in the steps of this procedure. So what they need before the cast to get the to activate this dressing. फर्स्ट दे हैव टू डिप द प्लास्टर कास्ट, जो रोलर ड्रेसिंग होती है प्लास्टर कास्ट की, दे हैव टू डिप इनटू अ ल्यूकवार्म वाटर. It should be in a large basin. So जब वो dip करेंगे, the moment the dressing of this cast dissolved in water, what will happen? It will release heat. वो हीट रिलीज करेगा. हीट रिलीज करने से एंड इट विल गेट एक्टिवेटेड immediately after dipping the dressing in water. We have to take out and then we have to remove excess जो इम्प्रेग्नेटेड सोल्यूशन है. इम्प्रेग्नेटेड मतलब उसके अंदर सोक ऑलरेडी हुआ है. आपने उसको कैसे एक्टिवेट किया? यू हैव डिप द ड्रेसिंग, द कास्ट ड्रेसिंग इनटू द वाटर. इट्स गेट एक्टिवेटेड. जब वो एकदम से वेट हो गया, एक्सेस सोल्यूशन आपने डॉक्टर ने रिमूव किया एंड इमीडिएटली यू हैव टू अप्लाई ऑन द अफेक्टेड पार्ट. You should not, the doctor should not wait, because otherwise जो रिएक्शन है, क्योंकि हीट रिलीज हो रहा है, वो क्या होगा? सेटल्ड होना स्टार्ट हो जाती है. सो यहाँ पे डिले नहीं करना है. इमीडिएटली आफ्टर वेट submerging, dissolving it in water, then take it out, remove the excess material and then apply on the patient. arm. So there are in total 3 layer we have applied: soft roll, cotton bandage, and then उसके ऊपर आपका ये cast हो गया. Then multiple layer में apply करेंगे, जैसे हम bandage apply करते हैं till this point. Always remember जो lower layer होगी वो soft roll की, वो उसके आपके behind this soft roll dressing it should you should stop your कास्ट. ऐसा क्यों किया? बिकॉज जो एज होगा कास्ट का इट शुड बी वेरी द एज ऑफ द शार्प can cause irritation to the skin. So in order to avoid that particular complication, we have make sure the end part of this cast dressing, कास्ट वाला जो ड्रेसिंग है इट शुड बी बिलो द सॉफ्ट रोल ड्रेसिंग. ठीक है जी, क्लियर? सो दिस इज हाउ द डॉक्टर कैन अप्लाई और वन कैन अप्लाई द प्लास्टर कास्ट ऑन द अफेक्टेड limb. Clear? So, and again, to make it more clear, you can watch the procedure. If you are working in a hospital, then do go do visit your department where this cast application procedure is going on. Now, one point which is very important, one multiple choice question, from this plaster cast application usually comes in your competitive entrance examination. Let's take an example that you are working in a department where one patient came to the OPD for removal of the cast. Patient came for the removal of cast. After removing the cast, listen this question very carefully. After removing the cast, as a nurse, where we should discard this plaster cast? As a nurse, in which biomedical waste bin we will discard this plaster cast? Now tell me what will be the correct answer. As a nurse, patient came to the OPD, you are there in the OPD and patient जो है plaster cast remove कराने के लिए आया था. The procedure is done. As a nurse, now you have to discard the plaster cast. So which biomedical waste bin we will use to discard? Very good, Shubham. Shubham has given a very beautiful and correct answer. This is yellow biomedical waste bin. This point you have to write down in your last minute revision notebook that yellow bin is used to discard the plaster cast. ठीक है? Here, चलिए, now let's talk about the assessment part of care of intervention part of patient with the cast application. If your patient is having cast on any particular part of a body, then we have to be very careful, especially the assessment part. What all thing we have to assess? First is you have to assess the pulse above and below the extremity in order to identify any kind of diminished blood supply. If you are not able to feel the pulse, then it might be because the blood supply is not rich, the blood supply is not good enough, right? So assessing the pulse below and above the extremity is mandatory. Then we have to assess for the presence of edema. It is multiple chances that patient can have swelling under the cast and you can ignore, and it can result into the swelling can increase, it can result into, it can compromise the blood supply. Patient can feel this tingling sensation, right? Tingling sensation, patient is feeling, and paleness can occur. This patient is unable to move the digit, the fingers, unable to move the fingers where the cast has applied above it. And there will be coolness or cyanosis because there is not enough blood supply reaching to that area. Why blood supply is not reaching to that area? Because of edema has compromised the blood supply. And numbness to any part, to the part, especially the distal part to the cast, every 2 hourly, right? So this is very important part. We have to assess the pulse, we have to assess for any kind for edema formation, cyanosis, numbness, whether the patient is able to move the digit, the finger part, or if it is a leg cast, then patient is able to move the toe or the fingers of the foot properly or not. Patient should not feel any kind of coolness or numbness. This has to be assessed every 2 hourly, right? Then there is one more point, is we have to assess for the pressure point, the skin breakdown, right? Because if the patient is having cast application, then there are higher chances then patient skin can lose integrity, right? Patient's skin can get impaired, get broke down. So such a type of assessment we have to perform on a patient with the plaster cast. Now there is one more point, which is assess for hot spot. This is very important. So what is this hot spot? This is not hot spot, this is not a hot spot. So what exactly this hot spot mean? We are not talking about the Wi-Fi here, the network connection, but yes, hot spot means that we have to assess for the sign of infection. What is this hot spot define? Sign of infection. Now how we can define this hot spot? Hot spot means if the patient is having pain, very severe pain at a particular part after the application of cast, if the patient is complaining of pain, if there is foul smelling, if आपको जो है फाउल स्मेलिंग आ रही है पेशेंट के कास्ट में से, इन द पेशेंट plaster cast, if you are getting or the patient is complaining of foul smelling, patient is complaining of severe pain at any particular point, then these are the particular sign for infection. We can consider that patient की वहां पे particular site पे infection हो रहा है. These are considered as hot spot. हॉट स्पॉट आपके क्या क्या हुआ? नंबर 1 फाउल स्मेलिंग, नंबर 2 इज देयर इट इज एसोसिएटेड विद सिवियर पेन, राइट? जो ये इंडिकेट करते हैं that patient is having sign of infection. So these are important point which we have to keep under the assessment part of patient with plaster cast. Now let us discuss the core intervention. सबसे जो basic intervention है that we have to perform especially on a patient with plaster cast is elevate their cast. मेक श्योर दैट द कास्ट, जो पेशेंट का प्लास्टर कास्ट लिम है, जो लिम जहां पे प्लास्टर कास्ट लगा है, इट शुड बी एलिवेटेड ऑन द पिलो until it is completely dry. Why we are doing so? This is very important intervention. कई बार क्वेश्चन आते हैं, make sure to elevate the limb, affected limb, or where we have applied the plaster cast until it get dry. The reason behind, to promote the venous circulation, otherwise venous circulation नहीं हो पाएगा, right? To promote the venous circulation, we have to elevate. Then another important instruction, we should not instruct the patient to use dryer or heated fan to dry the plaster cast. Otherwise what will happen, kai baar aisa hota hai na, without knowingly we tell the patient use dryer and to dry the plaster cast, or maybe patient itself जो है dryer का use करके plaster cast को dry कर लेते हैं. So what exactly happen with this? If they will use such type of equipment to dry the plaster cast, so with this the outer layer of the cast will get dry, but the inner layer will get wet, and that will again further will take lot of time to get dry. So this is something which we have to again advise the patient, do not use any type of dryer, hair dryer or heated fan to dry the plaster cast. Number 2, then again point come to the skin surrounding the cast. Point जो भी आप जैसे हमने पढ़ा, the cast should be below the soft roll. ठीक है, कास्ट का जो एंड होना चाहिए, इट शुड नॉट बी डायरेक्टली एंडिंग ओवर द स्किन, it should be ending the cast जो dressing है, it should be ending over the soft roll, so that it is not coming directly in contact with the skin. In this way we can make sure that skin जो है आपका affect ना हो, जो है intact रहे. Then you can massage the skin. Do not advise the patient to take any stick or pencil to insert inside the cast and do the itching. If the patient is complaining of itching, or कई बार ऐसा होता है ना, you can come across that patient with the plaster cast are saying that, sister, I am feeling itching under the cast, right? How we can manage such type of situation? Simply we can ask the patient to massage that particular area. In this way they can they can divert their mind, right? In case if you have to apply any kind of lotion or powder, it should be applied as per the doctor order. Otherwise there is no recommendation to apply any powder or lotion under the cast. It is strictly not advisable unless and until it is not ordered by the doctor. Clear? And when you are assessing, so always assess the edge of the cast and observe for any cyanosis, any numbness, any coolness or any reddened area, right? Then muscle strengthening exercises plays a very important role. So range of motion exercises can be done here. Isometric exercises can be performed by the patient to make the muscles more strengthened. Then any type of complication like pain, swelling, foul odor, or change in tight numbness, tingling sensation, or looseness of the cast, it should be informed to the staff as soon as possible. आइस पैक दे सकते हैं शुभम? यस, वी कैन अप्लाई द आइस पैक. आइस पैक का क्या फंडा है बेसिकली? व्हाट इज द रीजन ऑफ एप्लीकेशन ऑफ आइस पैक? until the cast, if after the application of plaster cast, ice pack can be applied, but it should not be applied directly on the top of the cast. Shubham, remember this, and all the students, those who are watching this lecture, do not apply the ice pack directly on the top of the cast. We can apply the ice pack on the sides of the cast, right, in order to minimize the pain. बिकॉज कास्ट जो है, जब आप कास्ट अप्लाई करते हो, इट रिलीज हीट until it get dry. वो हीट रिलीज करता है. सो इन अ वे वी कैन अप्लाई द आइस पैक, बट ओनली एंड ओनली until it is not get dry. जब तक वो ड्राई नहीं होता तब तक उसकी साइड्स पे ही अप्लाई करना है. डू नॉट अप्लाई ऑन द टॉप ऑफ द कास्ट. क्लियर? Understood? Yes. And then we have to assess for all the sort of complication that can arises. Swelling हो सकती है, swelling से बहुत सारी complication हो सकती है. So make sure swelling ना हो, and swelling को minimize करने के लिए क्या करना है? Elevate the cast until it get dry. ठीक है, elevate करके रखना है to minimize the swelling. स्वेलिंग नहीं होने देना है. स्वेलिंग होगा, इफ द स्वेलिंग अराइजेस, वेसल्स कंस्ट्रिक्ट हो जाएंगी. कंस्ट्रिक्ट होंगी, क्या होगा? ब्लड सप्लाई डिमिनिश्ड हो जाएगा. ब्लड सप्लाई डिमिनिश्ड होगा, क्या होगा? पेशेंट को जो है साइनोसिस, टिंगलिंग सेंसेशन हो जाएगा, और आपका पेशेंट का उस वो पर्टिकुलर पार्ट में पल्स फील नहीं होगा, राइट? कूलनेस हो जाएगा, राइट? Now generally जो patient होते हैं, those the patient with the cast application, pain management is also very important. So what are the ways, common measure that we can use to reduce the level of pain in a patient with plaster cast? So there are three important or common measure. Number one, पेन को जो है सबसाइड करने के लिए, यस, यू कैन एलिवेट द कास्ट, एलिवेट कर सकते हैं. नंबर टू, आइस पैक यूज कर सकते हैं. आइस पैक पेन के लिए यूज कर सकते हैं. नंबर थ्री, हम एनाल्जेसिक्स यूज कर सकते हैं पेन के लिए. एलिवेट, ice pack, analgesics. If you have elevated the casted limb, you have applied the ice pack, you have started the analgesic as well, but still the pain is not reducing, the level of pain, or it is increasing, that means it is clearly indicating कि patient को infection है या कोई complication हो गई है. We have to think something else, right? Clear? So these are some of the common nursing intervention that we can apply to a patient on plaster cast. Now let us see the complication. कॉम्प्लिकेशन क्या क्या हो सकती हैं? जैसे कि मैंने अभी बताया कि प्लास्टर कास्ट अप्लाई किया, बट जब अप्लाई किया इट वाज टू टाइट. वो इतना ज्यादा टाइट अप्लाई कर दिया प्लास्टर कास्ट. What happened after this? The tight application of plaster cast क्या करेगा? What it can result into? It can result into compartment syndrome. Now what is this compartment syndrome? मसल्स में, इन द मसल्स वी हैव सेक्शन और कंपार्टमेंट. मसल्स में क्या होते हैं? कंपार्टमेंट होते हैं. अगर इफ इन केस व्हेन वी विल अप्लाई प्रेशर, if you will apply pressure in these compartment, pressure कैसे अप्लाई कर रहे हैं? आपने बहुत ज्यादा, the doctor has applied the plaster cast too tightly, then what will happen? It will basically cause pressure to the muscle compartment, and if there is muscle pressure on the muscle compartment, then what will happen? The muscles will get squeezed, and if the muscles will get squeezed, then what will happen to the blood vessels? It will also get constricted. If the blood vessels get constricted, then what will happen? The circulation will get impaired. If circulation get impaired, then what will happen? Not enough amount of oxygenated blood will enter into the muscle or cell or tissue. It will result into ischemia. right? So there will be impaired circulation and compartment syndrome can occur if the cast is applied too tight or if there is any form of edema. So there are two important reasons through which the compartment syndrome can occur. Compartment syndrome is basically there is when there is excessive pressure on the muscles that can result into the impaired circulation, राइट और कैसे हुआ, या तो बहुत ज्यादा टाइट ड्रेसिंग लगा लिया, या फिर सेकंड रीजन क्या था, एडिमा फॉर्मेशन, इन्फ्लेमेशन हो गया, जिसकी वजह से कंपार्टमेंट सिंड्रोम बिल्डअप हो गया, जिसकी वजह से प्रेशर बिल्डअप हो गया मसल्स के ऊपर और वेसल्स के ऊपर एंड देन रिजल्ट इनटू द इम्पेयर्ड सर्कुलेशन. प्रेशर अल्सर हो सकता है, यस दिस इज ऑल्सो वन ऑफ द कॉम्प्लिकेशन. कैसे हो सकता है, यू हैव योर पेशेंट एंड योर आपके पेशेंट को जो है हिप स्पाइक का कास्ट लगा है या फिर लेग कास्ट लगा है, long leg cast hai, and patient is bedridden, patient is immobile, bedridden. If you will not perform any intervention, if you will not change the position every too early, then patient is more prone to develop the pressure ulcer. Skin integrity impair hogi if we will not provide skin care. Dermatitis, skin allergy, inflammation of the skin and infection hone ka zyada risk hai. So this is the reason we have to make sure that there should be 3 layer of dressing, right? The cast should not be applied directly over the skin. The layer of dressing should be done सबसे पहले soft roll, ताकि वो एक cushion की तरह act करे and provide जिसे हम बोलते हैं कि padding dressing apply कर रही है skin को. Then we have bandage, roller bandage dressing which will act as a absorbent layer, जो कि जो भी absorb करना है वो वहां से absorb करेगी. Then we have applied the plaster cast, जो कि आपकी protective outer layer होगी, right? And joint stiffness and muscle atrophy, yes it can also occur if we have applied too tight, if we have applied the plaster cast too tight, or if the patient is remain immobile, does not perform any range of motion exercises, then later on the complication can arise, right? Now compartment syndrome की अगर हम बात करें, so again यहाँ पे एक चीज जो आपको अपने रजिस्टर में last minute रजिस्टर में नोट डाउन करनी है, there is one question which always asked from this compartment syndrome is related to its sign and symptom, right? The sign and symptom of compartment syndrome, very important topic, very important topic for competitive point of view. If you are preparing for any type of any government nursing entrance examination, then you should be aware about the sign and symptom of compartment syndrome. So write down this in your registered. ये sign and symptom क्या है, 5, it is characterized by 5 P's. 5 P's होते हैं जो पता होने चाहिए. What are 5? What are those? Pallor, paresthesia. Paresthesia means tingling sensation. जैसे कभी होता है ना, if you are sitting in a position for a prolonged period of time, because of the diminished circulation to that dependent body part, you will feel tingling sensation, राइट जिसे हिंदी में बोलते हैं जब पैर सो गया बैठे बैठे तो थोड़ा टिंगलिंग हो रहा है, राइट? दिस इज वर्ड पेरेस्थीसिया. देन पेन इज ऑल्सो वन ऑफ द साइन एंड सिम्टम. पल्सलेसनेस, व्हाई पल्सलेसनेस कैन अकर? बिकॉज इफ देयर इज नो ब्लड सर्कुलेशन, देन pulselessness and paralysis, these are the later sign and symptom of compartment syndrome. The early sign and symptom of compartment syndrome is paresthesia and pallor, right? So compartment syndrome का early sign and symptom कौन सा होगा? Patient will feel numbness होगा, patient को numbness होगा, tingling sensation होगा, pallor होगा, pain होगा, pulselessness and paralysis होगा. So this you have to write down in your register, very important, right? So this is all about how we can provide care to the patient with cast. Now let us discuss some of the multiple choice question and short and long question which we can expect from this topic. So now you all have to read the question carefully and you all have to answer me कि इसका correct answer क्या हो सकता है. Which cast care instruction should the nurse provide to a client who just had a plaster cast applied to the right forearm? Select all that apply. We have already know that select all that apply का मतलब क्या होता है? That means it has, this question has multiple answer, more than one answer, right? So यहाँ पे one scenario is given to us. As per the scenario, there was a patient who just had a plaster cast application on the right forearm. What will be your nursing intervention? Now, what will be the correct answer? Keep the cast clean and dry. Allow the cast 24 to 72 hours dry. Keep the cast and extremity eliminated. Expect tingling and numbness in the extremity. Use hair dryer. Use a soft padded object that will fit under the cast to scratch the skin under the cast. Hanji, very beautiful question, and again the options are very amazing, but we need to select what are the correct answer. Yes, what is the correct answer? शुभम ने बोला है 1, 2, 3 and 6. देख अच्छा चलो ठीक है. शुभम said 1, 2, 3 and 6 correct होगा. Anyone else? आंचल ने बोला है 1, 2, 6. Okay. आंचल ने बोला है 1, 2, 6. Now one by one let us see the option. देखो सबसे पहला है keep the cast clean and dry, which is absolutely correct. शुभम ने अब अपना आंसर चेंज कर दिया. So option number 1 is absolutely correct. Yes, one of the nursing intervention is we have to keep the cast clean and dry. Option number 2, allow the cast 24 to 72 hour to dry. अब यहाँ पे हमें देखना है कौन सा cast apply. क्या यहाँ अपने scenario में is in the scenario is they have mentioned anything about fiber cast application? So no. In the scenario, they have not mentioned that they have applied fiber cast. They have mentioned plaster cast, which usually takes 24 to 72 hours to dry. That means option number 2 is also correct. Option number 3, keep the cast extremity and the extremity elevated, which is absolutely correct. We have just now discussed that after cast application, we have to elevate that limb or cast. Why we have to do so? In order to promote the venous return and to minimize the chances of swelling, right? So this also option number 3 is also correct. Expect tingling and numbness? No, this is a complication. This is not a correct answer. In normal cast application, we should not expect tingling and numbness. Use a hair dryer? No, this is absolutely wrong instruction. Used a soft padded object that will fit under the cast to scratch the skin. This is also not a correct instruction that we should give to the patient, because just now we discussed we should not let the patient to use any form of pencil or pen that can goes inside the cast for scratching. No, we can simply ask the patient to massage the skin which is above the cast, and if it is advisable by the doctor, as per the doctor, then we can use any kind of solution, but unless and until, do not use anything, right? So here option number 1, 2, 3 are the correct answer. Now let us see next question. This question is, the nurse is assessing the casted extremity of the client. Which sign indicative of infection? So which of the following sign indicate that patient is experiencing infection? Dependent edema, diminished distal pulse, presence of a hot spot on the cast, coolness and pallor of extremity. Which sign? Listen, you have to just see the options very carefully. You can see that all the options, don't get confused with all the option. Very good, Shubham. Very good, Shubham. This is anyone else? What could be the correct answer? Yes. So there is one question, in open fracture, how can we apply cast? Casts are usually preferred when when there is closed fracture, right? Cast are preferred in case of closed fracture condition. In open fracture, we have to perform the surgical procedure. After surgery, if there is a need to, immobilize the particular part of that surgery, then we can perform the cast. In closed fracture, the cast is performed. In case of open fracture, the person has to be undergone a surgical procedure. You must have heard about ORIF surgery. ORIF surgery is open reduction, internal fixation, right? So in case of open fracture hai, we can use traction, surgical procedure, depend upon the surgery, depend upon the condition, and then if it is advisable, the cast can be applied. But cast application is for closed fracture. Hanji, so yes, you all are correct. Very good, very nice. Option number C is the correct answer, which is hotspot. Dependent edema does not, indicate a sign of infection. Diminished distal pulse, it shows that there will be blood supply compromised. Coolness and pallor of the extremity also indicate that there is impaired blood circulation. Now, next question is, a nurse is uh, admitting a client with multiple trauma fracture to the nursing unit. The client has a leg fracture and had a plaster cast applied. Okay, plaster cast has applied to the femur fracture. Which position would be best for the casted leg? Elevate for 3 hours, then flat for 1 hour. Flat matlab supine position for 3 hours, then we have to elevate the limb for 1 hour, then keep the casted leg flat for 12 hours, then elevate the casted leg for further 12 hours, elevated on pillow continuously for 24 to 48 hours. What will be the correct answer? You have a patient with the plaster cast applied on the leg. So in which position we have to place the patient? The answer is Shubham. Yes, very good. Option number D. Very good, Anchal. Option number D is the correct answer. We have to make sure till the cast does not get dry, it should be elevated on the pillow. Next question is, the nurse has conducted teaching with a client in an arm cast about the sign and symptom of compartment syndrome. Look, dekho, there is two hint. Number one, the patient is already having cast. Number two is compartment syndrome. So we are providing education about the sign and symptom of compartment syndrome. The nurse determined that the client understand the information if the client states that he or she should report which early symptom of compartment syndrome. So in a entire scenario, we have to identify which of the following is early symptom of compartment syndrome. Very good, Shivangi. जो इससे पहले question था उसका आंसर था option number D. Very good, Shivangi. Now what is the correct answer of this question? Which is the early symptom of compartment syndrome? Remember 5 P's. Pallor, paresthesia, उसके बाद pulselessness, then paralysis and pain. These are the 5 sign and symptom of compartment syndrome. Now here we need to identify the early. सबसे पहले कौन सा होता है? Early symptom of compartment syndrome, which is numbness and tingling sensation in finger. सबसे पहले द मूवमेंट कंपार्टमेंट सिंड्रोम मतलब जैसे बहुत ज्यादा प्रेशर बिल्डअप होगा, कुड बी बिकॉज ऑफ टाइट ड्रेसिंग और बिकॉज ऑफ एडिमा, ब्लड सप्लाई विल गेट डिमिनिश्ड. So if there is minimized or decrease in the blood supply, it will cause numbness and tingling first, then it will cause pallor, right? Bluish discoloration, उसके बाद आपका pain आएगा, pulselessness आएगा, and then at last patient will experience paralysis as well, right? So option number 2 is the correct answer. So yes, this is again a very beautiful session जो आज हमारा हुआ है, and for undergraduate perspective, if I'll say, then generally जो question पूछा जाता है for 5 marks, it is based on the nursing intervention, or write down the nursing care plan if you are providing care to a patient with plaster cast, right? So I hope we have learned a lot in this session, and we'll see you all with another interesting session. Till then, stay happy, Stay healthy and remember the first 5 rule of a successful life. What are those? What are those 5 rule of successful life? Believe in yourself, trust yourself, love yourself, invest in yourself. Right? So with this, stay happy.